Welcome back to First Move. Fighting climate change is not just about saving the planet, it's also about protecting our health. The World Health Organization has reported that less than 1% of multilateral climate finance is currently directed to health-related projects. Well, our next guest says investing in health systems around the world is essential to economic and social well-being, as well as national security. And that includes protection against climate-related shocks by investing in our healthcare workforces. The WHO also estimates there will be a shortfall of 18 million health workers by 2030. Now, for the past 10 years, Sea Global Health has been working to strengthen those health systems. Since its founding, it has partnered with 4 countries, Malawi, Sierra Leone, Uganda and Zambia, and 30 institutional partners. The organisation has placed over 200 physicians, nurse and midwife educators and taught nearly 28,000 trainees. And I'm pleased to say joining us now is Dr. Vanessa Carey, co-founder and CEO of Seed Global Health. She's also a critical care doctor and director of the Global Public Policy and Social Change Programme at Harvard Medical School. She also happens to be the daughter of former US Secretary of State John Kerry. Dr. Carey, Vanessa, wonderful to have you on the show. That was a bit of a long introduction, forgive me, but I love the name. The idea of seeding communities across Africa with the information and knowledge and support to help them protect their communities. Just start there by explaining what you do and how it works.
Well, thank you very much for having me join you, especially at this really critical moment in time. Seed Global Health was really founded to partner with governments and institutions in Africa to ensure that they have the strong, robust, just strong health systems they need to be able to meet the health challenges that they see. And so over the last decade, we have partnered with governments in sub-Saharan Africa and with hospitals and training institutions to train actually now close to 40,000 doctors, nurses, and midwives who are in service to close to 72 million people across the continent.
This is astonishing. And in all of these countries, based on your work with governments, with, I know, NGOs and those on the ground, the focus seems to be of similar things. And it comes down to a greater need for maternal care, for protection of newborns, protection of children, in certain cases as well, mental health. Just talk us through how you've honed in on some of the key priorities.
Of course, I think the reality is that it's 2022, and it is truly unacceptable. We have such different standards of care in the world. A woman in Sierra Leone has 50 times the chance of dying in childbirth than a woman, say, in my home country of the United States. And we're fundamentally trying to change that. And so we do that by really identifying the most pressing health needs in the countries where we work, whether it is, pregnancy and childbirth, whether it is a child under 5 and the health issues they see with diarrhea or pneumonia or malnutrition, whether it is trauma. The World Bank found in Uganda that over half the deaths in the country are from a failure of emergency and triage services. And so we support training a rising generation of health professionals that can not only provide high quality care, but can stay and continue to train so that we're really building out a network of healthcare providers that are in response to the people in these countries and can make sure that that woman in Sierra Leone doesn't die. And it's really about, frankly, challenging the status quo that we have allowed to be really unacceptable for too long.
Just reiterate that statistic because it's just shocking. A woman in Sierra Leone 50 times more likely to die giving birth than a woman in the United States. I think if that doesn't illustrate the importance of the work that you're doing, nothing will. I think, and actually it's becoming very clear if people are watching the video that we're showing of the sheer quantity of women that are being shown here as healthcare workers. And there's sort of two ties here. There's the importance of sort of protecting many of the women in these situations with these healthcare emergencies, but it's also that 2/3 of the healthcare workers themselves are women. So providing them with the essential skills and support in the work that they're doing helps tackle the gender divide in a completely different way and in a vitally important way.
Absolutely. 70% of healthcare is provided by women. And so we are really talking about a gender equity opportunity. And women, I believe the statistic is about 3 billion of work in the healthcare sector goes unpaid. And so there's an opportunity by investing in training a health workforce and investing in formalizing this sector in countries around the world to be able to create jobs, to build economies, to create gender equity. And I think that most people don't realize, but there's very strong data between better health and better GDP growth, and or whether a household lives above or below the poverty line. And a lot of that is tied to creating jobs for women. A lot of that is tied to making an investment in their main asset, which is their ability to go to work. And if you're not healthy, you cannot go to work, you cannot care for your family. And so this investments in health are truly, for lack of a better analogy, a tide that lifts all boats. And there's a huge opportunity for us to recreate our world by investments in health.
Yeah, it's essential for a functioning society, for a healthy functioning society. And I don't just mean in health terms. Where do the educators come from? How long do they stay? Where does the financing come from? Because this is a critical part of it. If those that are imparting their knowledge and providing wisdom and experience to those that are working in these communities, just give us a sense of how that works and crucially where the money comes from.
We are deeply privileged that we partner with ministries of health, with governments in the places that we work, and we work together to identify faculty to fill the faculty shortages. I'm sure in many countries around the world, you will find that there's a doctor, nurse, and midwife health provider that came from another country. And in fact, it's estimated that the brain drain of physicians and nurses has left huge gaps in these countries. And so we recruit folks to come back. They spend a year of their life serving alongside existing faculty to build out the faculty enough to be able to continue training and ensuring that there is high quality mentorship in a clinical setting. One of the things we do that's very different and that you just can't replace with telemedicine is that we teach at the bedside. And so when there is a breech birth, you actually have somebody to be with you, to guide you how to do it, and then it happens again. We've seen this time and time again, the power of saving lives, what it does to transform people's sense of hope, of optimism, of understanding of what can be achieved. And so we do this entirely through philanthropic funding. All of our funding comes from foundations and people who are willing to be on this journey and to really support it, as well as now increasingly we are building a coalition of folks that really are trying to give to this bigger effort writ large. We've just announced in September, the Clinton Global Initiative, $100 million commitment that we need to raise and work towards, and with some of our partners like AMREF and others, to really be transformative and to invest in these health systems to make them stronger, more resilient. Even after COVID-19, only 60% of countries have strong emergency preparedness response. That means 40% of our countries are left completely vulnerable to another global pandemic. We have a lot of work that we need to do, and we deeply believe that there is no such thing as too ambitious for this moment that we're in, and that it is critically important that we invest in health to address the whole range of issues that we face, be it migration, pandemics, and the ability to have a healthy workforce that can be investing in our better world.
I have about a minute left, but I mean, everything that you just said there in terms of the challenges are all exacerbated by the impact of climate change, the need for migration, lower labour productivity, communities struggling to take care of themselves, never mind, the need to be able to afford or pay for adequate, decent health care. Vanessa, just tie it to your reason for being in COP and what you hope to achieve there.
Absolutely. Thank you. I am here at COP because there is going to be a huge rise in death and suffering from climate change. We don't do anything about it. And the ability to have a health-centered investments in our climate response are going to be critically important. And the workforce is critically needed to address that growing burden of disease that we're going to already see, 250,000 deaths a year, 216 million people estimated to start migrating because of some of these problems. Right. And so we have a critical need to ensure that we are prepared and able to really see health as integrally tied to the climate crisis as well.
Yeah, fundamental to saving lives. Dr. Vanessa Carey, great to have you on, and I no doubt we'll speak again soon. Please come back and talk to us again. The co-founder and CEO of Seed Global Health there. Thank you.